In 1986, a group of parents came together to take action to address the skyrocketing lead poisoning rates in their children. They formed Parents Against Lead.
One of the great actions that the parents took is they dressed their kids up as canaries and protested down at City Hall that they no longer wanted their children to be canaries in a coal mine. They no longer wanted kids to be lead detectors. They realized that they needed to formalize the organization.
In 1993, the group became the Coalition to End Childhood Lead Poisoning, a nonprofit group advocating for families, providing hazard intervention services, legal, relocation, and education services, and policy work. Today, the number of children in Maryland diagnosed each year with lead poisoning or elevated blood lead levels has dropped by more than 95%. The coalition developed and helped to obtain the successful passage of historic legislation that helped to establish a national movement to create healthy housing standards so that every child has the opportunity to grow up and thrive in a safe and healthy home.
We were leaving houses lead safe, but children were still sick. They were still getting injured. They still had asthma. There were things in the home that continued to make kids sick. And a lot of this came from our workers who went into homes and saw this firsthand, who came back and reported time after time that while we were making homes safe for lead, we were still leaving behind these sick kids and needed to do more. And so we slowly started to build toward that, and with the Casey Foundation in 1999 began what was the country's first fully funded Healthy Homes program. Not only did we need to make homes lead safe, and not only do we need to reduce allergens and safety hazards, but we needed to look at what was going on in terms of the investment in housing in low-income communities. And the major initiative that has come about in the last couple of years has been the initiative to green up housing in communities that really being green was not an affordable option. This really provided an enormous opportunity for us, and it continues to provide an enormous opportunity.
That opportunity became the Coalition's Green and Healthy Homes Initiative. Now, when the Coalition goes into a home to test flaking paint for lead levels, they look at the house holistically. Dorothy O'Bannon's 2-year-old has severe asthma. She contacted the Coalition for assistance.
My 2-year-old, she was in and out of the hospital 13 times. I'm on a fixed income, I'm low income, so it's helped me in that way because I don't have the resources like that. And if it wasn't for the Coalition, I would still be living in that environment. Who knows, my daughter might not be here.
They provide an invaluable service for our families who truly are underserved in multiple different ways. And to have that education in the home directly with the families and directly seeing where the problems are is invaluable in treating a chronic disease such as asthma.
The Coalition to End Childhood Lead Poisoning has become a leader on a national level in the green and healthy home movement. They attribute much of that success to the partnerships and collaborations they have been able to form.
We give them funds to continue to do what they do best, which is help improve the life chances of kids and families by reducing elevated blood levels and decreasing the incidences of asthma in the homes, and really helping to improve the health of the homes and the families that we care about.
40% of all asthma cases are triggered by the home environment. If we just eliminated that, we would save $5 billion a year.
Success would mean that there are healthier families, greener homes and communities, better quality jobs, green jobs around construction, weatherization, energy auditing, as well as a better educated workforce that knows how to go in and do comprehensive healthy homes assessments, and they also develop a pathways of opportunity around this work long term.
We also know that we will improve school outcomes. We know that we will lower juvenile crime and delinquency, which is linked to lead poisoning. And for all of the other ills that we cannot prevent, what we can prevent is what comes from the home and impacts a child.